Imagine a single spelling mistake in your DNA that quietly unplugs every muscle you own, starting with the ones that you need for breathing. So that's spinal muscular atrophy. It's the top genetic killer of babies, yet most people have never heard about it, like they don't know the name. So today we're zooming in on the bag that tells the body to hit delete on its own strength. So meet Leo. He's an bright-eyed boy. He's never kicked his legs, unfortunately. So while other babies cycle in the air like tiny Tour de France riders, Leo's thighs look like the vacuum seal. So his mom, who we'll call Sarah, caught the red flag quite early. So he could wiggle his fingers, but he couldn't lift his head. That doctors said that he probably just has low tone and they just sent them home. So 2 weeks later, he stopped breathing during a nap. So that last nap lasted 12 seconds, but for Leo's parents, it feels like 12 years. So spinal muscular atrophy, or SMA type 1, shreds muscle neurons so fast that untreated 9 out of 10 kids like Leo never blow the second birthday candle. So here's the bag in plain English. You own 2 copies of a gene called SMN1, and you get 1 from each parent. So together they print a protein that keeps the wires between the spinal cord and the muscles alive. So that connection is kept alive. So you lose both the manuals and the protein vanishes. In that case, the motor neurons starve, muscles wait for a text that never arrives, and then they downsize themselves like an office that keeps firing staff. The kicker though is we all carry a backup gene called SMN2, but it's a bit lousy. It's like a lousy photocopy. Only 10% of the pictures print correctly. So SMA patients survive on that shaky backup, so their neurons slowly go offline. The earlier the break, the faster the collapse. Symptoms for SMA can masquerade as everyday laziness, child being floppy, having floppy limbs, they can't sit, they're missing their milestones. So because weakness creeps in gradually, families hear things like he'll catch up until the cold lands them in the ICU. A simple blood test can find the missing SMN gene. It isn't a cheap test though, and only a handful of places in Africa do genetic testing, and even fewer do newborn screens. So that delay is deadly. Every day matters for these children when the neurons are vanishing. The test that we routinely do in the clinic setting to try and separate SMA from other conditions that present with low tone is just looking at the child's tongue. Children with SMA have something called tongue fasciculations. So you'll actually notice that the tongue is moving around a bit, it's dancing. And that is something that we almost only see in spinal muscular atrophy. There are 4 types of SMA. So type 1, the children with type 1 are born too weak to swallow and they're ventilated from like day 1. Most of the children don't survive. So type 2, it presents before 6 months. So these children don't get head control and they normally survive just for the first year. They develop some strength but lose it after. They may not be able to walk. In type 3, it presents at about 6 to 18 months. They can sit. So it's seen mostly during childhood or during teens. They're able to walk, but sometimes they'll lose that ability to walk. No type of SMA is pain-free, but type 1 and 2 are the executioners. So until a few years ago, SMA was a death sentence. Most of these children, if they are type 1, they would die like a few days after birth. If they had type 2, they would die within like their first year of life. And it was the type 3s that survived, but even they sometimes got weak as they started walking. So but then a few years ago, some drugs were discovered that are now changing the natural history of this condition. So there are some that are injectables that are injected into your spinal canal, and these help boost that SMN gene that we talked about, SMN2, that sort of get it to pick up its game. There are others that are given orally. So there's the some that patients can swallow, and then there are other that's like a one-time injection. So all these are available, and they have really changed the course of life of these children. The issue though is that they're very expensive, and at this point they're not available in some. The issue though is that they're very expensive and they're not readily available in very many places. But that is still hope. But that is still a very, very big step, because in the past these children just wouldn't survive, and now they are surviving because of the availability of this medication. If you found this video helpful, don't forget to like and subscribe. And until next time, keep it on little growing bones.